al'umma in Allah ya so za ka isko kashi 10 ko kashi 20 na wannan rashin lafiya.
Okay, this is sensitization for the purpose of ensuring that our traditional and religious leaders take the immunization being viewed through the gender lens to improve healthcare delivery services in the state. We have the report has shown that we have some circulating variants and we have low coverages on immunization, and also we are facing seasonal variation which could actually predispose the state to cerebrospinal meningitis. So this gathering is aimed at ensuring that the entire this gathering is aimed at ensuring that our religious leaders take the message through the weekly contacts and sermons that they present during the Juma'at preaches, to ensure that the role of male in healthcare delivery services is being emphasized to support the women and children in accessing healthcare delivery services, especially immunization, through providing resources to the women as they are going to facilities, to even go along with them to help them in accessing healthcare services. We also want them to deliver the message that had to do with preventive measures, especially on immunization, avoiding overcrowding, sleeping under insecticides treated nets, and also in a well ventilated place, improving immunization coverages, and also ensuring that hand and environmental hygiene is being improved, so that all diseases that have the potential of spreading across the community are being curtailed. Yes, you know, these changes, the seasonal changes, always comes with diseases like cholera, meningitis, measles, diphtheria, and all other vaccine preventable diseases. So we want to make sure that we raise the level of awareness, especially at the community level, through these gatekeepers. Our state has this peculiarity that whatever you want to achieve, if you go through the religious and traditional leaders, the messages goes down and also goes well. People respect, listen, and implement whatever they get from these leaders. So it is our hope that they are going to provide these sermons and, at the Juma'at mosques and also in their various places. There is a new concept of community-based surveillance that we are also trying to implement. In community-based surveillance, the conventional method that is being used as a country now is facility-based surveillance. But you find out that there is this concept or phenomenon known as tip of an iceberg. That is the presentation you find if you use facility-based surveillance. But we want to ensure that we encourage the use of community-based surveillance, because we piloted it in one of the LGA in 2021 when we had an outbreak of cholera, and we realized that it worked very well. It has actually eliminated, if I can use that word, or nip the transmission of the cholera in those LGAs. So we are now expanding the concept not only to cholera but all preventable diseases. So we are engaging the religious leaders, especially the head of Islamic schools, the primary and secondary schools, to take active surveillance in ensuring that all children that come to school were not allowed to enter except they are being screened for temperature. at least using the infrared thermometer to ensure that their body temperature is within normal level, because high grade fever, headache, vomiting, and others are signs and symptoms of meningitis and other vaccine preventable diseases. So any child that is picked in this process, we recommend he should be taken to the nearest facility, and then we'll know the type of case we are dealing with, and we ensure that he is not allowed to mingle with all other children so that it is not being spreaded. The concept of community-based surveillance is what we are adopting as against the facility-based surveillance. Facility-based surveillance waits until the patient report to the facility. And anytime you see one case in the facility, there might be up to 100 cases in the community. So we don't want to allow until that. We want to pick any vaccine preventable disease in the community and nip it at that level without allowing it to escalate. These are some of the measures supported by the Ministry of Health under the leadership of our able commissioner to make sure that disease prevention and control are taken in control and are being properly addressed. As of today, we did not receive any confirmed case of diphtheria in the state. We have not received.